Another important aspect of survival for cardiac arrest victims is by the early use of an automated external defibrillator, or AED. Some patients become a victim of cardiac arrest due to a very specific type of irregular heart rhythm that prevents the heart from pumping blood effectively. The AED's purpose is to provide a shock to the heart, called a defibrillation, to stop this and return the heart back to its normal rhythm. There are several different manufacturers and models of AEDs, however. They all similarly operate the same. Most AEDs, once opened or turned on, will light up and begin with a series of text or voice prompts on how to operate it. It is important to follow those instructions exactly. Step 1. Retrieve the AED. AEDs may be located in public places and in private businesses. It may be mounted on a wall in a box designated with a heart and lightning bolt symbol. Several businesses and schools in our district have them. Once located, retrieve it and bring it to the victim's side as soon as possible. It is very important to utilize the AED as soon as it becomes available for the victim. Step 2. Startup of the AED. Ideally, somebody should be performing chest compressions while another person readies the AED for use. Most AEDs will power up once it is opened, and some may require depressing of a power button to activate it. Please follow the voice or text prompts for your specific device. Step 3. Apply the pads. You will be instructed by the AED to apply pads to the victim's bare chest using the pictures shown on the pads. If they are wearing an underwire bra or have jewelry in the area where the pads are needing to be applied, quickly remove them. Modesty and privacy is a concern, however, saving their life is what's most important. If the victim is wet, such as if they were in a tub or a pool, quickly dry the chest with a towel or clothing prior to applying the pads. The victim does not have to be completely dry, only the chest. Once the pads are applied, you may have to plug in the connector to the AED. Please note, there may be 2 different types of pad connectors in your AED, one designated for children and one for adults, which will be notated on the packaging. Step 4. Analyze and shock if indicated. Once the AED pads are applied and the connector is plugged in, the AED will begin to analyze the heart rhythm. It is very important that chest compressions are stopped and that nobody is touching the patient during this time. The AED will indicate if a shock is indicated. Once the AED indicates this, do not allow anyone to touch the patient and depress the shock button on the AED to deliver the shock. Once the shock has been delivered, resume chest compressions. The AED will have an internal timer to check again after 2 minutes and will announce when to stop compressions. Not all cardiac arrest victims will have a rhythm that can be shocked. If the AED indicates that no shock is advised, just continue with chest compressions until help arrives. Thank you for watching our hands-only CPR and AED video. Remember, a victim's best chance of survival starts with you, the bystander. Together, we can save a life. Thank you from the Bexar County 2 Fire Department for watching.